Most people automatically assume that health examinations are always beneficial. But what if I told you that some of these very tests could actually put your life in danger once you reach a certain age? I know that might sound strange, but not all exams and screenings are as harmless as they seem. In fact, many of the most popular screenings for older adults can lead to risky treatments, unnecessary anxiety, and false alarms. This isn't meant to scare you. It's simply a growing realization among medical professionals, especially when caring for patients over 70. A new understanding is emerging within the medical community. As we get older, a one-size-fits-all approach to testing might do more harm than good. In this video, we are going to dive deep into 5 specific health examinations that seniors might be better off avoiding. Screenings that even many experienced medical professionals often decline for themselves. We'll explore why these tests are so widely recommended, uncover their hidden risks, and discuss safer alternatives that can empower you with knowledge without putting you at risk. If you're watching this on your TV, feel free to grab your phone or remote to search for our channel on YouTube. Once you find us, hit that subscribe button and turn on the bell notification so you never miss a new video on health, nutrition, and thriving in your senior years. And if you enjoy what you learn, please give us a thumbs up or leave a comment. We genuinely love hearing from you. You deserve healthcare that respects your unique body, your age, and your overall well-being. This video is for you if you care deeply about your health but want to avoid being overtreated, overmedicated, or overwhelmed by our current healthcare system. Our goal isn't to frighten you, it's to arm you with information, confidence, and a clearer understanding of what truly supports your health after the age of 70. Let's begin. Our first point of discussion is the colonoscopy trap. For a long time, colonoscopy has been considered the gold standard for preventing colon cancer. However, for those over 70, especially without symptoms or a family history, this test can subtly shift from being beneficial to genuinely detrimental. A screening that could have saved your life in your 50s or 60s might, after a certain age, become a source of unnecessary risk, anxiety, and even hospitalization. Why? Because the procedure itself carries significant concerns. It involves sedation, extensive bowel preparation, and the insertion of a scope deep into your intestines. For a younger adult, this is already taxing, but the dangers amplify dramatically for older individuals. Seniors face risks like severe electrolyte imbalances and dehydration from the bowel cleansing process alone. Furthermore, older bodies can be more sensitive to the sedatives used during the procedure, potentially leading to confusion, lightheadedness, and a higher risk of falls. But there's something even more concerning. Many older individuals, particularly those over 75, often undergo follow-up procedures or treatments for tiny polyps discovered during a colonoscopy. Polyps that might never have become harmful in the first place. These slow-growing abnormalities often take 10 to 15 years to become problematic. And for someone in their 70s or 80s, those years may simply not matter. Yet, the discovery often instills fear in the name of prevention, initiating a cascade of further tests, including biopsies, repeat scopes, and even partial bowel resections. When these interventions carry hazards that outweigh their benefits, prevention can actually turn into harm. Here's an example I'll never forget. My friend George, 82, active and sharp as a tack, was persuaded to have a routine colonoscopy. Despite having no digestive issues, during the preparation, he became severely dehydrated. After the procedure, he was drowsy and disoriented, and that evening, he fell at home, breaking his hip. That single test resulted in immense stress, significant medical bills, and months of grueling rehabilitation. And you know what? The scope found nothing. The point here isn't to blame doctors. They're operating within their training. But as medicine evolves, so must our approach. If you're over 70 and symptom-free, it is absolutely acceptable to decline a colonoscopy. Many now find non-invasive stool testing to be a safer, simpler, and more efficient alternative. It's about evaluating the true financial, emotional, and physical cost of subjecting your body to something that might not be beneficial. Better care after 70 often means fewer interventions and more thoughtful decisions. We must stop assuming that more testing always equates to better care. Being discerning doesn't mean you're ignoring your health. You're honoring it. Next, let's talk about the allure of the full body scan. The idea of a whole body scan has an undeniable appeal. Imagine a machine meticulously examining you from head to toe, promising to uncover any hidden issues before they become serious problems. It sounds like brilliant prevention. However, for seniors over 70, this strategy often works against them rather than for them. While the intention behind full-body scans may seem proactive, the results they generate frequently trigger a cascade of anxiety, invasive follow-up testing, and even unnecessary procedures that could potentially shorten, not prolong, your life. Let's be clear, full-body CT scans and MREs are not your typical screening tools. These powerful machines are designed to detect everything, and I mean everything, including harmless anomalies that have no bearing on your lifespan or health. These incidental findings, as they're called, have the potential to become mental time bombs. A tiny nodule here, a subtle shadow there, and suddenly you're caught in a seemingly endless cycle of follow-up appointments, biopsies, and specialist visits, all in pursuit of something that may never have been significant. Why is this more critical after 70? Because the aging body no longer responds in the same way. What might have been a straightforward biopsy at 45 can now result in weeks of recovery, an infection, or even a collapsed lung. Even simply lying still for an MRI can be physically demanding or uncomfortable for aging joints. And what many people don't discuss is the emotional toll. Seniors often bear the burden of worrying about what might be, instead of appreciating their current state of health. Consider Betty, a 78-year-old woman I met at a senior health conference. She was active, took daily walks, and had no complaints. Yet, a mobile clinic offered her an inexpensive full-body scan at a health fair. On her kidney, they found a microscopic lesion that had caused no problems and likely never would. But the mere word lesion sparked terror. Within a month, she underwent surgery. The aftermath: months of recovery, a significant decline in her vitality, and lingering issues that never fully resolved. All for something that may have remained entirely unknown and benign. In medicine, this is called overdiagnosis. On an emotional level, it's unnecessary fear. It's also financially draining. Insurance rarely covers full-body scans unless there's a compelling medical reason. So many seniors end up paying out of pocket, believing they are buying peace of mind. In reality, they're often buying a ticket to a system that might never stop testing. At this stage of life, responsibility looks different. It means trusting your body a little more. It means listening to your intuition rather than solely to what machines report. It also means recognizing that not every shadow on a screen is worthy of your dread or your precious energy. Please let me know in the comments section below. Number 2, if you're still watching and finding these ideas helpful, if you haven't already, I encourage you to subscribe and turn on the bell notification so you don't miss any future videos. Your support allows us to continue creating high-quality content to educate and uplift you. All right, let's move on. The third issue is the overuse of cardiac stress tests. For years, the treadmill stress test has been considered the standard method for identifying heart problems, especially in older adults. The reasoning seems simple. Push your heart, see how it reacts under pressure. However, this line of reasoning can backfire after the age of 70 in ways many seniors are unaware of until it's too late. After a certain age, a procedure that was once helpful in your 50s and early 60s often becomes dubious and, at times, dangerous. The main reason is that cardiac stress tests in older adults frequently produce what medical professionals call false positives. This means the results can indicate you have a heart condition. Even when your heart is functioning perfectly fine, our bodies naturally change as we age, leading to these deceptive results. The heart's electrical patterns shift, arteries can slightly stiffen, and blood pressure fluctuates more, none of which are necessarily signs of illness. However, the stress test doesn't know that. It simply flags something out of the ordinary, which can trigger a chain reaction of anxiety and further testing. This cascade can include angiograms, catheterizations, and occasionally even stent placements or bypass procedures, all carrying significant risks. For the elderly, those dangers are not trivial. We're talking about risks of blood pressure drops, hemorrhage, and kidney damage from contrast dye. Recovery after such procedures is harder, and complications are more frequent. What starts as a simple treadmill test can quickly find you in a hospital bed, wondering how it all happened. Let me tell you about George, a 74-year-old retired bus driver. During a routine physical, his doctor, just to be safe, ordered a stress test, even though George had no chest pain, shortness of breath, or fatigue. The next thing he knew, the questionable results led to a referral to a cardiologist. 3 weeks later, he underwent an angioplasty to remove a blockage that wasn't causing any symptoms. Within a month, George developed a severe infection at the catheter site, ended up in the intensive care unit, and spent the next 6 months in and out of rehabilitation. He has never fully recovered his previous quality of life. Now, ask yourself, was that treadmill test truly worth it? In reality, a growing number of respected heart doctors and geriatric societies now advise against routinely stress testing older, asymptomatic individuals. They agree that if you're not experiencing symptoms like chest pain, shortness of breath, or unexplained fatigue, the benefits are often minimal and the potential dangers are significant. This is especially true if your goal is to live well rather than simply to live forever. Psychologically, the idea of checking your heart has a powerful draw. We feel our heart is central to who we are. It's life's drumbeat. So, naturally, we want to ensure its health. But this is where wisdom comes in. The aim of healthy aging isn't to fix every potential problem. It's about avoiding medical excess that can take more than it gives, maintaining your independence, and listening to your body's true signals. That doesn't mean you should ignore your heart health. Absolutely not. But instead of jumping on a treadmill at the doctor's office, focus on the fundamentals: daily walks, a healthy diet, nurturing social connections, and managing your stress. After 70, these are the things that genuinely keep your heart robust. Not machines, not wires, and not tests designed for people half your age. In this time of our lives, discretion is paramount. It's about having the courage to decline something simply because it's offered. It's the ability to realize that not all tests are gifts, and sometimes, turning them down is the best thing you can do for your life. The very thought of colon cancer can be terrifying. It can strike without warning, and by the time symptoms appear, it might be too late. For this reason, for many years, colonoscopies were heralded as one of the most vital preventative procedures in modern medicine. Here's the truth, though. Many people aren't aware that for some individuals, especially beyond the age of 70, the risks of colonoscopies frequently outweigh the benefits. In fact, for certain elders, this test may actually do more harm than good. Let's start with the procedure itself. Colonoscopies require complete sedation, and anesthesia carries considerable risks for older patients. As you age, your brain becomes more vulnerable to the effects of sedatives, and your liver metabolizes drugs more slowly. This makes older individuals more prone to postoperative cognitive dysfunction, a fancy term for lingering confusion, memory issues, and brain fog that can persist for weeks or even months after the treatment. Then there's the bowel preparation. If you've ever had a colonoscopy, you know this part. Consuming large quantities of powerful laxatives to cleanse your system. For older people, however, this process can be deeply upsetting and it can disrupt your electrolyte balance, interfere with kidney function, and leave you feeling emotionally and physically drained. One misstep can lead to lightheadedness, dizziness, and potentially even a fall in the bathroom at night. This isn't an overstatement. Falls during colonoscopy preparation are more common than most people realize, particularly among older adults living alone. But perhaps the most overlooked problem is the benefit time horizon. Colonoscopies aim to find slow-growing polyps that might turn into cancer in 10 to 15 years. If you're already in your 70s or 80s and have a history of previous clear tests, the chances of those polyps developing into anything harmful during your remaining years are quite slim. Indeed, several medical societies now state that as people age, the risk of complications like bleeding, perforation, and adverse drug reactions rises dramatically, while the potential benefit becomes negligible. Consider the case of Eileen, a 78-year-old retired schoolteacher. She had clear colonoscopies at ages 68 and 73. However, just to be safe, her doctor recommended one more at 78. She agreed. During the procedure, her colon was inadvertently perforated, a rare but dangerous complication. She underwent emergency surgery and spent nearly a month in the hospital. Eileen survived, but her independence dwindled, and she never fully regained her previous level of vitality. She often wishes someone had warned her that the test might not be worth the cost. Why does this happen? It's partly medical habit. If something worked at 50, surely it must still be good at 75. But aging changes the equation. What once protected us can now become a burden. And while cancer is a legitimate concern, it often makes people lose sight of their true objectives at this stage of life. Maintaining mental acuity, emotional stability, and mobility. For a marginal increase in longevity, no screening test, no matter how sophisticated, is worth compromising those cornerstones. At this age, it's more important to pay attention to genuinely present symptoms, such as blood in your stool, persistent abdominal pain, or unexplained weight loss. Yes, in those situations, an investigation is absolutely necessary. But without symptoms and with a good history of screening, a routine colonoscopy can be not only risky but also unnecessary. We need to reclaim our agency here. Being informed means understanding the trade-offs, not just following procedures because that's what you're supposed to do. Your body deserves to be treated with respect and not subjected to risks that no longer offer a proportionate advantage. Please let me know you're still watching this video and finding these ideas helpful by leaving a comment using number 4 below. If you haven't already, I encourage you to subscribe and turn on the bell notification so you don't miss any videos. Your support allows us to keep producing high-quality content to educate and uplift you. Alright, let's continue. Fifth, let's talk about the excessive use of routine heart stress tests. There's something about heart disease that feels like a ticking time bomb. We hear stories of people who seem perfectly healthy one day and then suddenly collapse the next. So, it makes sense to want to catch any problems as early as possible. This is why cardiac stress tests, either treadmill or chemical tests that monitor your heart's reaction to pressure, have become so popular, especially among adults over 70. Here's the unexpected reality, though, for a significant number of seniors, particularly those with no cardiac symptoms, these exams often cause more harm than good. The idea of a stress test feels comforting. You walk on a treadmill, they monitor your heart, and if something looks off, they take action. But the truth is more nuanced. Most adults over 70 already have age-related changes in their cardiovascular system. Mild arterial stiffness, a little plaque here and there, or a longer recovery time after physical exertion. These are often normal signs of aging. However, when they show up on a stress test, doctors can interpret them as warning signs, potentially leading to further testing and possibly unnecessary interventions like stent insertions or angiograms. That's the dangerous part. These follow-up procedures carry real repercussions, especially for older patients with more fragile blood vessels and reduced kidney function. Catheterizations can lead to bleeding, stroke, or kidney damage, and once you go down that path, it's difficult to turn back. One test leads to another, and before you know it, you've undergone a series of procedures for a condition that might never have troubled you in the first place. Consider Harold, a 76-year-old grandfather from Illinois. He had no chest pain or shortness of breath, walked every day, and loved playing with his grandchildren. During his annual physical, his doctor recommended a stress test just to be sure. After the test showed a minor irregularity, a cardiac catheterization revealed some non-obstructive plaque. Still, the doctors decided to implant a stent, due to complications from the blood thinners after the procedure, which was based on an unnecessary test for a non-urgent issue. Harold ended up in the hospital with internal bleeding and spent the next 3 months recovering. So, why does this happen? Fear plays a role. Fear of missing something, and fear of what might happen if we do nothing. But at this point in life, it's crucial to prioritize quality over quantity to preserve energy, independence, and comfort, rather than chasing after unidentified issues. A growing number of respected cardiologists today advise against routinely stress testing asymptomatic elderly persons. The evidence simply doesn't support it. It doesn't reduce mortality or heart attacks. And for those who don't exhibit any symptoms like dizziness, shortness of breath with minimal effort, or chest pain, it's not only unnecessary but potentially harmful. Symptom-based care is the better approach. Yes, if you experience changes in how you feel during activities, new fatigue, pressure, or a racing heartbeat, then an evaluation makes sense. But if you're feeling stable, sleeping well, and maintaining an active lifestyle, your body is already telling you a more accurate story than a computer ever could. As we age, aggressive intervention must give way to thoughtful observation. It isn't about surrendering, it's about leading a prudent life. You don't have to fight every illness that could possibly arise. You must protect your dignity, your time, and your clarity. Being older doesn't mean being powerless. If anything, it's the moment in life when we're mature enough to slow down, ask ourselves, is this truly for me? And challenge the system. You see, sometimes, in a society that exalts more tests, more checkups, more medications, the bravest course of action is to do less, and not from carelessness, but from a profound understanding of your body, your values, and your objectives. At this point in your life, in your 70s and beyond, Healthcare shouldn't be a series of impersonal procedures and automated tests. It should be a thoughtful discussion about your priorities, your ideal lifestyle, and the risks you are genuinely willing to take. Mindlessly following procedures created for younger bodies can cost you years of your life, as well as your energy and peace of mind. Doctors are trained in a system that often prioritizes illness over respecting health, not because they intend to cause harm. If this video has caused you to reconsider or offered you a fresh perspective on your health, it has already served its purpose. And remember, declining some tests doesn't mean you're neglecting your health. It means you are being purposeful. You are weighing the pros and cons. You are realizing that not all tests lead to understanding. Some lead directly into a tangle of anxiety, overdiagnosis, and needless treatment. So, take charge. Communicate honestly with your physician. Ask if the exam is genuinely likely to change your care plan or your ultimate outcome. Consider your comfort, your time, and your energy. They are invaluable at this age. You deserve to live your life as you see fit, without fear but with careful consideration. Without being overburdened with processes, but empowered with knowledge, and without constantly preparing for illness, but instead actively constructing a meaningful, joyful, and connected life. We appreciate you being with us today. We would be absolutely delighted to hear from you. Tell us in the comments section below one thing you learned today and how you intend to apply it in your life. We value your opinions, so please feel free to share them. Reading your comments is a source of great inspiration and encouragement for us. If you found this video informative and helpful, please like, subscribe, and share it. Your support enables us to continue producing high-quality content to educate and uplift you. Thank you for your time, and we hope to see you in the upcoming video.